Why do we fail in the ADC Communication OSCEs? Let's break it down. I've got so many messages from people saying that, we've done all these courses, we've sit down with this instructor and that instructor, have done that course, and we're still failing in communication. We don't know. Please help us. One thing, good news for all of you, I did post it on my ADC page on Facebook as well. I'll be starting a comprehensive ADC Communication OSCE course, on-site course, not online, because I don't believe in online learning for communication. Let's be really honest. I've taught students who have passed now, and the reason they were failing is because all the things were done on Zoom and phone calls, voice calls. You don't see people's faces. When you sit down with someone and tell them to do a scenario, it's such a whole new experience, and they're like, oh my God. And you record it and show it to them. What do you feel like? Are you going to pass yourself? And they'll be like, I think I'm going to fail myself every time I do it. With your technicals, if I show you the video and assess it and you prepping all the time in the house, you can learn it. And that's the reason I have a very detailed online technical course. Communication, until and unless you don't sit down with someone and they correct your body language, they correct your posture, you correct so many other things which are required, that gives you a major help in passing and failing. So let's break it down. Why are we failing in communication? What's such of an issue? Why is it help? Why is it failing? Number one, I discussed in my previous videos as well. If you haven't seen them, please go and watch it. Number one, we are scripted. We are fully scripted. It's a script in our mind, and we have got notes from someone and we have just memorized it so much. As soon as they say it's an ulcer, we're like, ulcer. This happens, that happens, this. And the examiners are so pissed. You see people's ADC exam experience videos and they're saying the same thing. They're saying the examiners were so upset that, the first thing they'd be like, the last 6 people, they told me the exact same thing what you're telling me. You have to understand that the same scenarios are coming now. All the 50 scenarios, this list and that color list. All the questions, even the ADC examiners know as well. Everyone knows what the questions are. What happens when you go to the written exam? What's the first thing we learn when you go to a written exam and we're new to the ADC format? That we feel that the questions are same, they always twist something in it. So what happens when you script it? You go there and you sit down and you start talking and you be like this, and they'll be like, he didn't even understood the question correctly. The first 3 minutes, go and watch my communication videos if you've not seen it. The first 3 minutes, you have to assess it, read the question, do the mapping. You exactly need to know what you need to do, and then behave as a dentist. Close your eyes and say, I'm a dentist, I'm going to follow what I treat a patient. So the biggest misconception and the biggest mistake I would say everyone is doing is they are scripted. They already have a script in mind and they want to follow it. Now, as we say, not one set of teeth are similar to the other. That means patients are not similar to one another. Scenarios are not similar to one another as well. So if you try to put one scenario in the other side and fit in every single scenario, the ulcer scenario in one, it's not going to fit. You're not going to pass. And what happens? They point out to that one point where you get confused and now you don't know what the answer is. So the first thing is, don't have a script in mind. That's the biggest mistake in my personal opinion anybody can do. You don't need a script in your mind. Just be natural. Read the scenario. Practice. You have done with someone. You know how it needs to be done. And then just go and just behave as you treating a patient. Simple that you will do. Second thing, which is very important, is how much knowledge do you need? People are going crazy on reading 200 books and 20 books and this notes and that notes. And every time people show me notes from people, I'll be like, isn't it the same thing that you get from therapeutic guidelines or Dell's clinical version 4 ADC Actors OSCE document? What's something new that someone has provided you notes, and it might be amazing notes. And I don't want to go and say these notes are bad and these notes are good. That's why I don't like calling names for any clinician out there. But just think logically. What's something new in the notes that you felt it was not written in the therapeutic guidelines or the other two documents I already talked about? If I say that, okay, Dr. Mak, you have to go and take a diagnostic management plan, you need to do information gathering and make a finalized provisional plan, and then the final plan, short and long term, for a 10-year-old patient. How many books do you think I'm going to read? Will I say, I need 2 months first, I will read 20 books first, then I will go sit in. I will say, I don't need that much knowledge to explain a 10-year-old. Exactly that. You don't need all that knowledge and all those books. You need basic information, and now you need to practice with someone. They tell you exactly how to interpret that knowledge. Role play sessions are more important than someone sitting down with you and telling you information about what a dry socket is and what a TMJ problem is and how to diagnose it. You all know that already. Basic information. And then you need to know, which is an important element of our communication OSCE, is what to say, how to say it. That's exactly. And once you practice that, you're natural. You're not scripted in the exam and everything flows, because you go, you read it, you make a map in 3 minutes and you exactly know this scenario, I'm going to treat this way. And you're doing that diagnosis in your mind and having a final plan in those 3 minutes. You're not scripted. You don't close your eyes and say it's an ulcer and I'm gonna go no. Maybe it's a different scenario that they've given now. So whenever you don't train your mind and more try not to modify based on the situation, you struggle in the communication OSCE. And that's what's happening with people. The examiners ask you a basic question and they say that it's an extraction consent form, but I want to save the tooth now. Now the student is stressed. But I studied all that, give you the consent form for extraction. Now he's saying I want to save the tooth. So what? Can't the patient ask you that you can save the tooth? You don't know what are the options to save the tooth? Or is there a viable option to save the tooth? Or isn't it the better option to save the tooth? Can't you talk about that first? And later he might say, actually, I might actually go and proceed with an extraction. Can you tell me? And then go for a consent form. What they're trying to see is if you're an actual clinician, or can you actually go tomorrow and work in a clinic and manage patients? Or you're going to say that, oh, because I only read the 50 scenarios and it was a TMJ ulcer. Now he's asking me about a white lesion. It was not in the scenario. And now I can't treat a patient. That's what you're going to tell them, right? Because ADC is passing you so you can sit tomorrow and do patients. So you have to justify it to them. The second biggest mistake is so much information. People are like, I need this information. You don't need too much information. You need basic knowledge. The struggling bit or the problem is you need to know exactly how to say it, what to say it, and how to exactly say it. That's the people everybody struggles, and with very little people are teaching these. The most important element, people are practicing with their mates at home and both of them are not aware of it. When you go to a teaching center, they should be focused on role plays more. You should have 10 one-on-one role play sessions or 20 one-on-one role play sessions with your whoever is teaching you. That's going to give you a high value back, rather than having that now I know all about dry socket and I know all about TMJ. I know all about how to treat a carious decay lesion and a kid with multiple decays or uncooperative child, and I know exactly how to pull a tooth out. You already knew all of that. You can just read an article and read a paper and read therapeutic guidelines. You already have that information. How to say that information, that's where people struggle. The third thing which is again very important. People are going and telling in the scenarios that they're asking you that about implants. Now you have to understand you are doing a general dental exam for a general dentist, and they're judging you as more like fresh graduates. You're coming as a fresh graduate, you're going to work as a fresh graduate. So what ADC want to also check is, when they pass you, are you going to go tomorrow in the clinic and start doing sinus lifts and those curved root canal treatments and those complicated impacted wisdom teeth or not? Because you're putting a life in danger. And to be honest, even if I'm the ADC instructor, I will be feeling the same thing. That someone's coming from overseas and in their head, they feel like they can do a wisdom tooth as well. They can do an implant as well. They can do everything. So you're sitting down in the scenario and they start asking about a wisdom tooth. I'll be like, yes, I'm going to raise the flap like this and I'm going to section the tooth like this. It's a general dentist exam. They want to judge you on the basis of a basic fresh graduate. So don't talk about a specialist and how it proceeds. Just tell them that this is out of my scope. I would refer in this case. That's what they want to hear. But the problem is, some of them are really experienced and they take very personally that why would I refer? For this exam, you have to be a general dentist again. You're a fresh graduate. So tomorrow, if a clinician is working in the clinic and there's a sinus lift patient tomorrow, basically you're telling ADC that I'm going to go and do a lateral window tomorrow? Really? Do you think they're going to pass you? Because that's what you're telling them, that, I'm going to pass tomorrow, I'm going to start doing wisdom teeth and all that. That's the biggest problem. This is not a specialist exam. They want to ask you what a general dentist do, and you can meet with general dentists in Australia. We have a lot of legal requirements here. Lives matter and lives should matter. And it's very ethically important that when you are dealing with patients, you have to be very ethical and very careful on the treatments you do. You can't say that, I will do this as well. No. You have to be 200% sure on what you do. And any point you feel it's out of the scope, you have to say, I'm going to refer you this. So whenever you have scenarios like implants and curved root canals and wisdom teeth, you have to talk about referrals. And I'll talk in detail about this in my new communication course that I'm starting. As I said, it's going to be a 3 to 4 days on-site course. It will happen in Sydney and Canberra. But at the same time, I'm also planning that if we have more requests, because at the moment I have over 35 people on waiting list. If we have more requests from anywhere in Australia, then we can fly to that city and we can have a 3-day setup there. So we can talk about Melbourne, we can talk about Perth, we can talk about Brisbane, we can even talk about New Zealand, Adelaide, Tasmania. We can do that. But communication, in my opinion, has to be so many role play sessions so you get in the zone of understanding. Then you can go with online. That's fine. But you have to have the one-on-one with someone, especially if you can. And I feel it's going to give you a major value back. Because sitting down on the phone, laying down on the sofa, on the couch, closing your eyes and talking about someone, hey, I will do this and that. No, you have to sit down. You have to behave. You have to get in the zone of exactly how to do it. So the third problem which a lot of people fail is because they ask you about wisdom tooth and you start explaining them, don't tell them referrals, you start explaining them, this is how I'm going to do it. So they get scared that, I'm going to pass this person tomorrow. They're going to start doing wisdom teeth tomorrow. And we're talking about all the complicated cases. Fourth thing, which is again very, very crucial, is whenever you feel you're not ready, don't sign up for the exam. Problem is people say that, I've already booked, my exam is in 2 months. Can you help me? Is it a joke? For me, it's not a joke. To be honest, I feel like it's too casual. I booked the exam in 2 months and can you just help me? One thing we have to understand is I don't do one-on-one role play sessions without doing a proper course, because I feel you cannot assess someone. You need to do a 3 days full course so you be able to assess it and we can point out every single detail on how it should be done. So you're trained the right way. If someone does 2 role play sessions with me or 3 role play sessions with me, like same thing if someone messages me and they say that, I want assessment session. So they come to me and I tell them, this is the mistakes, you're failing in this criteria, that criteria. And then we realize the whole technique of doing a technical task is wrong. Now they're like, oh, but what should I do? It's like, ideally you should do an endo course or a crown prep course first. So you learn all the techniques. So you first learn how it's done the right way and what is required in the exam, and then you do the tasks. Now, if someone comes and say, oh, just do an assessment for me, I'm like, I'm happy to do assessment. This is wrong, and this is where you're failing. And now they're like, oh, but what should I do? I was like, that's the thing. There's no shortcuts. So if a lot of people message me and they say, I want to do 2 role play sessions, we are like, no, I don't do it that way. You have to do a full course or join someone else's course. I can't. Because I feel like if someone joining my course, there's a lot of responsibility on my shoulders as well, making sure I'm guiding them the right way. Because if I can't do 3 days sessions and then just, 3 hours a session and then you're good to pass, there's no shortcuts. Either do it the right way or pick a different mentor. I'm not the right mentor for you because I don't do small and shortcuts. You have to do it the right way. There's a reason my technical course is 3 months, 6 months long. I can also teach a 1-week course. I know it. These things don't work because I can show you how to do a crown prep and endo and everything in a day. How many of you will understand that? How many of you are going to capture that in your mind? You can't. So that's why as we are now starting the on-site technical as well for people, we have decided and we have been open to everyone that you have to be a part of my online course first. So you've been doing the training for 3 months. So when you come to the on-site, then you're already ready to the point that we can do everything in a week or 2 weeks. But if I just call you for a week course and you do a week course and go back, 90%, it really depends. I don't want to give a number because it's going to be biased to other people, but most of you might not get because you're not even ready to that stage. You just book a course. So it has to be a slow process. You get good learning and you get better learning out of it. 2 days course versus a 3 months course is a massive difference. So that's very important. Communication, as I said, you don't need a lot of information. People are busting them off like this notes and that notes, and how much information you need talking to a 10-year-old. So just imagine that you have to talk to a 10-year-old. How many books will you read? You have to behave as a fresh dental graduate. Go and meet a fresh dental Australian graduate. Meet them in person, find out what sort of skills they have, what sort of practice scope they have, what sort of work they do. You will find out exactly what I'm trying to tell you. Because ADC, and see, we as a clinician, we have a lot of responsibility, right? We want to make sure that tomorrow when we're seeing patients, we're doing the right treatment protocol. So someone hasn't even worked in Australia, they come and they feel like they have so much experience in the past, they cannot justify it, how good or bad. Because we don't know, right? Maybe you have 20 years experienced or 2 years experience, but maybe the 2 years experienced one is better because they were trained in the right way, and the 20 years experienced one was doing something wrong for 20 years. Doesn't justify that you'll be doing right according to the Australian standards as well. Again, I'm not trying to say that the person who had done 20 years is wrong. There are amazing clinicians out there with 20 years and no experience as well, with 2 years experience and 50 years experience as well. But what I'm saying is you need to be able to justify everything. So communication, I personally feel people are failing because scripted. I hear people all the time, scripted. They have not practiced role play with people and they have not practiced role play in person, especially. It's on voice calls and Zoom meetings and you can't, unfortunately, you can't. You have to do on site. And if you can't, then yes, there's no other way that's different, but ideally to give you the maximum value back. Same thing, the notes and this notes and that much knowledge, you don't need that much. You already have 3 books, you have therapeutic guidelines, you have adults clinical, you have, some articles out there, and you have a Version 4 document, you have the majority of the information. Half of the time when people are failing and you talk to them, what did you actually tell to the examiner? And you start talking, I'm like, is that information you all get from the 20 books you were reading? Because you don't need 20 books to answer this, right? And they were like, yes, I don't need 20 books. If you would have worked on how to say it and what to say it, you would have got more value back rather than, just working on. So my communication course is launching very soon. As I said, I've already got a 35 people waiting list. So it's already a long list. We are currently starting with on-site 3 to 4 days sessions in which we're going to do 1 day basic knowledge, and the next 2 days we're going to do role play, full on role play sessions, role play. So you have done so many role play sessions, you exactly know what to do. Then you go back and then you have a portal of videos that you can review and you can have online support with us, but not before doing that. So Australia, I will be starting with Canberra and Sydney, and then future, if more people are in Melbourne and there's a group of 5, because I've decided I'm not going to go any more than group of 5. So 5 to 6 maximum, so we can practice role play with them. And that's how I have designed the course. So 5 people if you have in one of the city, and if you message us either on my Instagram, Dr. Murtaza Mak, or Facebook, ADC Help with Dr. Mak, Dream Project, you can comment below on the YouTube with your email address and with your contact details. Some of our team can contact you, and then we can look into it. Even if you're in New Zealand, if you have 4 people, 5 people, we're happy to just come there and conduct a course. But that's what I'm going to start, because I feel most of my students, 95% plus, I'm very proud to say that they pass most of the technicals, but then they're struggling so much in communication. It's so basic. Communication is so basic that, people have just complicated it too much. So Dr. Mak signing off. We'll see you all in the next video. Till then, stay healthy, work hard, and we'll see you all very soon. God bless you.